You know, one of the problems, or actually two of the problems that Mississippians deal with, and well, more so than most Americans, is diabetes and obesity. I mean, Mississippi is #1 in both of those areas, unfortunately, but of course it's rampant all over the country and all over the world. Well, today on the show, we're at the National Diabetes and Obesity Research Institute to find out some of the great work that they are doing, the programs that they are involved in, and how they're helping people overcome those issues. Emily Foray is the Director of Development here. How are you?
I'm good. How are you?
I'm wonderful. Thank you very much. Give us an overview, if you would, about what you do here, kind of an idea, and some of the statistics that y'all work with.
Yeah, so like you mentioned, Mississippi unfortunately has remained above the national average when it comes to diabetes and obesity. So we want to focus on Mississippi, but we also want to focus on the epidemic nationally as well. So what we're trying to do is really hone in on some of the innovative approaches that we can to address these issues. And here our mission is to reduce diabetes and obesity through prevention, treatment, and education.
Mm-hmm. Yeah, that's one of the major things people don't know. I mean, and then sometimes they find out, they go to the doctor and find out, well, you're pre-diabetic.
Right.
And there's a point there that they can reverse that.
Yes. Yeah, through education and just managing their weight, maintaining a healthy weight, eating healthy, it can all be managed.
And I hate to say this, but we in Mississippi have a tendency not to eat healthy. I mean, we're used to Southern food and fried chicken and buffets and things like that. So it's really hard unless you have somebody that's going to actually work with you and train you to follow the right program.
Correct. Yeah, and our dietitian might tell you can eat anything you want, just in moderation.
That's the big thing.
Yes.
Moderation. I mean, and that comes a lot with losing weight as well, because if you're wanting to lose weight, you can't just go and, remember when of course, you're a lot younger than I am, but your mom said, clean your plate. I don't care how much you put in it, clean your plate. And that's a big thing. Don't waste food. There's starving children there all over the world. So you were obliged to. Unfortunately, it's taken a toll on people the older that they get because, yeah, they've cleaned their plate. They've, went back for seconds. And now they're dealing with obesity. They're dealing with high sugar issues and hypertension, and high blood pressure, diabetes, high cholesterol. I mean, it's just, it runs rampant out there where, 50 years ago, it wasn't that way.
Correct. Yes.
So you have some different programs that you work with. You have some great food products that you work with people, you provide people with in which they can use.
Yes. Yeah, and we'll talk a little bit more about that when we go into our clinic. Our dietitian, Emily Davis, will tell us a little bit more about our services.
Okay.
But I'll tell you a little bit more about where we're located. We are on the Tradition Medical Campus. We call it the Traditional Medical City. We're located next to Mississippi Gulf Coast Community College and William Carey's Tradition Campus.
So it's real easy to find.
It is.
It's real easy. Well, Emily, thank you so much.
Yes, sir.
And we're going to go talk to the other Emily, find out some of the great programs that they're doing here at what they call Ndori. Now joining us is Emily Davis, who's Director of Education here. How are you?
Good. How are you doing
today? I'm
today?
very well. Tell us a little bit about the clinical programs that y'all have here at Ndori.
Absolutely. We have a variety of offerings here for patients in the community. We have myself and another dietitian that we do individual medical nutrition therapy appointments. So not only offering education and guidance on diabetes and obesity, but a variety of health conditions like high blood pressure or GI issues, that sort of thing. We also have a full meal replacement program to help with weight loss. We use OptiFast, and we help guide patients through that protocol. And patients can lose an average of about 50 pounds on this program over about a 6-month time span.
Wow, that's a good deal.
It is. And part of that, too, is education. We actually meet with that group weekly to provide them lifestyle education changes. We have diabetes self-management classes here and at another location in D'Iberville for those that are suffering from diabetes. And we also have a diabetes prevention program. So we're currently recruiting for participants for Hancock County and Stone County, trying to catch that population in Mississippi that is at risk for diabetes but have not yet developed it. And so hopefully we can catch it early and prevent, or at the very least delay, that progression into diabetes.
Now, the name says a lot. Ndori is a national for a research institute is what I was getting at there.
Right.
Y'all do a lot of research here.
We are starting to. So we are starting to do some clinical trial recruitments. Currently we have several GI programs going. So things like fatty liver, ulcerative colitis, and Crohn's. And then we are working diligently to bring additional trials to the community, especially for the diabetes and obesity community. But we're starting to see that fatty liver plays a really big role in a lot of chronic diseases. So we're excited about that.
Awesome. Well, we want to go and take a look at one of the training rooms here at Ndori in Biloxi. So Emily, tell us what's going on in this classroom.
So today we are having one of our shared medical appointments, which is a unique option we can offer to patients here at our clinic. We definitely see a lot of struggles with billing, especially for dietitian services in the state. And so this is a way where we can provide access to education on a variety of topics in conjunction with the physician seeing the patients. And it's a really good group setting to bounce ideas off of each other and get a lot of information.
That's awesome. Well, one of the other things they do, and it took me a while to be able to even pronounce this, is indirect calorimetry.
You got it.
Hey,
Yes.
so let's go find out what that's all about.
So here we are doing indirect calorimetry, which is the gold standard to check patients' metabolic rate. So this is a service we offer on a cash pay basis, and patients can get an actual reading of what their body needs, and we go through a report with them, and it really helps us guide their journey as far as weight loss and weight management goes. So we can show them exactly what they need on a day-to-day basis, and where they should be to continue their weight loss journey.
Now, this is something, again, it's all followed by a physician.
Absolutely.
That's one of the important things. So whenever people do come in here, they know that it's, they're monitored by a physician
Yes.
and by professionals as yourself.
Exactly. Everything is physician supervised, and we are both specialists in obesity and weight management.
Now, do they need to go through their general practitioner to get recommendation to come here?
So if anyone is interested, they can call us and we can send a referral form to their provider, because a lot of insurances do require that.
Okay. Thank you so much,
Thank
Emily.
you.
Appreciate it. Now, again, if you want some more information about the National Diabetes and Obesity Research Institute, as we mentioned, they're out here in Tradition Parkway.
Tradition Medical City.
Tradition
Yes.
Medical City. But come out here, you need some help with obesity or diabetes, they'll be glad to help you out.